We can get a beverage. Anybody else need water? Anybody need water? Before he gets started? Kimmy's told you why it's so yummy. Now Dr. Gallo gets to tell you why you need to do it, what it's going to do to your body if you don't.
Dr. Gallo, do you not eat animal protein very much?
Not very much. I live with a wife who doesn't like it.
So
you
Susan
go
cooks, he
like
doesn't get any.
meat without any animal protein?
No, usually I have once or twice a week we have meat.
Once or twice.
I've got one text of her personal, something she's not texting.
I think that is one of the work. I think we get one.
That's why I didn't want to argue.
Thank you.
Come out in your trunk, you know?
Neither.
Nobody else go to the bathroom? I guess I went for you all.
Thank you.
Well, good evening.
Good evening.
Thank you so much for, I call her brisket. I call her kibby and organic bits. Thank you, Scott, for laughing at that.
She's been my kibbles for a long time.
That's so sweet. That is sweet. So what did you think when she came home and said, we're going to start a whole new...
It was exactly like she said. I was, as long as it tastes good, okay.
Yeah, it tastes great, doesn't it?
But you feel so much better when you do
I
it.
had lost my mind.
Well, have anybody, like I say, I had a patient say, Dr. Gallo, I tried that, but the first couple of shakes, I couldn't take it, so I couldn't do it. I did 2 shakes, did first one on your recommendation, and I almost died. And then I did the second one, and I died. So I'm not doing it anymore. I said, you know, I have a cell phone. It takes text messages. And I said, the reason I give you my cell phone number is so you can call me and tell me this. Because I would have said, what color was your stool? We're going to have more poop talk tonight. And the fact is, that person needed that worse than anybody. But they didn't continue. Now I got her in a case the next time she came. And she's trying them again. I haven't talked to her yet. Just yesterday I saw her. But let's talk about digestion for a minute so we understand just the nuts and bolts of it. So the food goes in the mouth. You chew it. That's the first part. How many of us actually chew our food? Seriously? Oh, good. Some people are actually telling me actually chew their food. How many people forgot that they ate because they eat so fast? How many people actually put their fork down between every bite? It's a good idea. But if you have a Vitamix, you don't have to do that, right? Just boom. That's the perfect. Instead of standing in front of the microwave going, hurry up! Just put it throughout. So it's actually less time than you think. By the time you cook all that food and prepare all that food, if you have it pre-washed, you just throw it in there, boom, and go. Every morning I make our morning smoothie. I make the dog food, which is a big assembly line, because they have to take more vitamins than I do. Yeah,
And there's 4
they
of them.
do. And they're what?
There's 4 of them.
There's 4 of them. Yeah, so, but it takes more time to take their food than our food, honestly, because the blender is just you put it in Vitamix. We have a Vitamix and another one, and they work great. But when you first put it in your mouth, you really should chew it because there's amylase up there, which works in the carbohydrates. Then it comes down to the stomach, and the stomach has hydrochloric acid, or HCl, and that breaks up protein. And then, after a while, after 2 hours, I should say, the stomach dumps. Really? Let me see if there's anybody in this room with that. Usually after 2 hours. But what happens is, since our stomach acid is insufficient, it's 4 hours, and 6 hours, and 8 hours. And you can actually go into medical dumping. That's actually a medical term. That dumping syndrome is you don't go to the bathroom until you eat, and then you go to the bathroom. That's the worst. That means you absolutely are not digesting your food. You're just making room for it when it comes in. So the stomach is actually only designed to have food in it for 2 hours. That's it. But when it stays in there 4 hours, and 6 hours and 8 hours, this is the typical start of heartburn and GERD, gastric reflux disease. So what happens is, instead of if this is the diaphragm and we're looking at it sideways, here's the stomach. And so the stomach now usually pulls up, and if we're looking down on it, here's the diaphragm, there's the stomach slit. The stomach comes up like this out of it. So it pulls up out, and then this guy gets loose. Why does it get loose? Because you don't have enough stomach acid. So now you have constant regurgitation. It's not necessarily contents, but it starts out with just gas. The fumes, in other words, from the stomach, not the gas coming out the other end, as you think with the gas, but the constant fumes bombard our vocal cord and our palate, and then our taste changes. Well, how do we get low hydrochloric acid? All you have to do is eat cooked food and age, and you're for sure going to have it. There's other things like antibiotics and other drugs that really take it down. But if you're eating cooked foods, you should be supplementing hydrochloric acid, or you're not going to get your groceries. Again, what does hydrochloric acid work on, primarily?
Protein.
Right. So beans have a lot of
Protein.
and so you're not going to get those people who have problems with beans. This might be part of the problem. The other part is they have a lot of fiber. So if you throw undigested protein and fiber together, you get a storm. Somebody got that, right. You get a raging storm. Yeah, perfect storm, right. Not so perfect in the bathroom. So there's a dumping place here for the stomach, because this properly digested hydrochloric acid food, called a chyme at this point, the chyme or food bolus comes down into the duodenum, and duodenum holds that acid food bolus and makes it into alkaline. So in other words, there's got to be a place for the stomach to dump into so it doesn't burn out the rest of the small intestine. Or else you're going to be, you have one acid stool. Typically the body will weather one acid stool, and your brain is going to say, hey, Mr. Stomach, turn down that acid. So again, here's another reason for low hydrochloric acid. There's a lot of reasons for it. So what neutralizes this acid food bolus into alkaline? Anybody know? Bile salts, or bile. Yeah, what's that secreted by?
Liver. Gallbladder.
Liver, and somebody said gallbladder, which is true. Actually, the gallbladder doesn't, the liver makes it, which is absolutely correct. And the gallbladder is like a zip drive. It's a storage drive, and it takes it and dehydrates it, makes a smaller molecule. And so that when we smell fat, or when we eat fat, or we even think about fat, the muscles contract, and the gallbladder starts to rehydrate the bile, and so we have bile ready. So a lot of times when we're nauseated, it's that rehydrated bile, there's no food in there. Or when we're nauseated, there's this whole process going on, and the muscles squeeze, but it can't go anywhere because there's a clog right in here. Now this is the bile duct. There's only one way out of the liver. So everybody knows that the liver does what? It cleans, right? It happens to do 3,000 separate metabolic, 2,000, excuse me, 3 separate metabolic functions, 2,000 functions. One of them is to produce and secrete bile. So here comes the dirty blood, and here goes the clean blood, right? Coming out this way. Can't draw upside down. But remember I said we had one exhaust pipe from the liver? What happens if this is clogged? Backs up. Right. This backs up into the portal system, which is in the small intestine. This is the nutrient exchange in the small intestine. The portal system in the small intestine exchange nutrients. It's a vascular design so that the nutrients can go back to the liver. So one of the types of hypertension is what? Portal hypertension. So basically in portal hypertension, your liver's backed up into your small intestine. And the reason it's vascular is because it's the reason it's hypertension is because it's highly vascular. But what happens if this is clogged? Number one, we don't have enough fat. Can we lose weight when that happens? Absolutely not. But the toxins can't go anywhere, what happens? And if we're balled over like this and we say, please take me to the doctor, please take me to the doctor, forget the doctor, I want the hospital. You know what they do? They say, oh, you must have a bad gallbladder. And so you know what they do?
Yeah.
Let me tell you right now, gallbladder surgeries are like the surgeries du jour. I mean, they want to get in there and cut that out because, again, the gallbladder sits in this muscular fold that presses down every time there's fat in the equation. Smell it, think about eating it, boom. And if this is clogged, you go, oh! And so they take that out, and so the muscle squeeze, and so there's no gallbladder there, so usually that'll take care of that. Really? Did they really get the real problem? No. So, and they make you sign a sheet saying you still may have the same problems after the surgery. And now, they usually go into the belly button, blow your stomach up with gas, they just snip it and take it right out like it was nothing. Somebody said, yeah, I know that's right.
They take pictures
And they
of your
tell
belly
you,
when it's
And you know what they don't show you? The doctors in the audience will know that there is the gallbladder is supposed to look like a blue robin's egg. When it doesn't, it looks like it came from a witch. I mean, it's all noduly and it looks like a toad, a green toad. But they don't show you that green toad because half the time it's a nice blue robin's egg when they take it out. Really, most of the ones they take out are actually not the problem. It's just the problem. But it relieves the symptoms for a while. And guess what? The doctors know this. Not most of them. Why? Because there's no drug for this, so they don't talk about it. There is no surgery to root this out. If I want to be a millionaire, I'm already rich. It comes from here. But if I wanted this kind of rich, I'd have been a surgery for that because everybody needs this. Susan and I were speaking about it one time, and we said, you know, how much percentage of the people who come to you probably have a blocked bile duct? Because she knows, because she had it. It took me 7 years to unblock Susan's bile duct. Why? Because there's different things you could do. You have biliary sclerosis, which is the worst one, which means it's hardened, and that's what she had. And medically said, you know, we can't change that. Bull. You can change it. It took me 7 years with her. So what happens is you need to take bile salts if they take your gallbladder out for the rest of your life. Do they tell you that? No. No. So basically, anytime you have a stitch right here, anybody have a stitch right here? Or a pain right in here? Or pains in this shoulder in general? Or even pains that mimic a heart attack? You know, some of the heart attack experiences are gallbladder attacks. And most of the gallbladder attacks are bile duct problems. But they don't know anything to do with go in there and snip that out. And every scar creates scars in your metabolism as well. I mean, it's a problem for your metabolism. Your body doesn't understand when it has scarring. It has to be neutralized.
Can you take bile salts if you don't have your gallbladder removed?
Can you take? Absolutely. Now, most doctors will say, I don't like to give bile salts, or if I do, I'm going to give it sparingly because there's a negative feedback loop there because you can get addicted to them. Rubbish. No way. Well, there is a way, but there's a way to get you off of it as well. So, you're going to depend on it for a while, and you should depend on it to clean it out. But then all you have to do is use herbs and hydrochloric acid to rotate you off of it. Here's the deal. When this guy doesn't have enough bile to change what happens? The brain is going to send a message to shut off the hydrochloric acid. So, if you don't have enough bile, you get low stomach acid. If you don't have enough stomach acid, you get low bile. One happens, the other one must happen. So in treating this situation, the doctor must first unclog this, or the patient must, and then replenish the stomach acid. Now, there's a problem with that. The stomach acid sets up the pH from the mouth to the tail. But once this goes down, now a salad can be dangerous for you. And that's the first thing we run to. In fact, you should avoid cabbage and lettuce family foods if you're having a gallbladder attack. It's worse. Yeah, it gets worse with that. But once you don't have enough acid, you have to understand you are susceptible to all the bugs that are on the salad. It's our first line of defense to bugs, the parasites. Regular critters that wouldn't bother you are now going to bother you because now they can set up shop. So until you change, if you've come in here and you said I've said you have a parasite, or if you think you might have a parasite, well, first of all, how many people in this room have parasites? We all do. Okay, thanks. I didn't look, but here. So you must change this so that you stop the environment for the parasite. Have to. Now, how do we change this? We take hydrochloric acid until we get heartburn, and then we titrate down. Now, there's a problem with that a lot of times. If you have any scars on the midline or any potential scar, can make your stomach not work. So you can take, if you give a child a half a gram of hydrochloric acid, they'll throw up. It's too much for them, but because they typically, well, not now, with what makes the stomach acid low? Cooked food and what else?
Sugar.
Processed food. Anybody eat live food in this besides Mrs. Kibble and Bits? Well, I do too, but how much of your diet is that? Until you're about 80% raw food, you're going to have low stomach acid. And even then, you get old, you get low stomach acid. So how do you know if you have a problem with that? Do an ounce of apple cider vinegar. If it burns, you've got a problem with that. Yes, ma'am?
You go to a gastroenterologist, they'll give you more acid.
They'll give you more acid? They give me a pain in the butt mostly, but they give you more acid. And anybody you went to a gastro and they gave you more stomach acid?
Yeah.
That's good.
I was gonna say that's the right thing to do.
That's the right thing to do. Mostly, haven't heard, mostly they want to give you antacids.
That's what
Yeah.
they do.
Yeah,
That's different.
mostly they want to give you proton pump inhibitor. As a matter of fact, I had a prominent doctor in here, and he had been on proton pump inhibitors for 12 years. I went, Doc, you know on the label what that says. Yeah, don't use it over 6 weeks. Yeah, but you've been using it for 12 years. He says, well, yeah, 2 good points. I said, Michael, they work. That's okay, that's a good point, but guess what? They're not functional. They might work to get the heartburn down, but they're not functional. Something else works too, it's called fixing it. But the other good point, and he thought it was a good point, was that he doesn't have anything else to do. I said, that's a pretty good point, except again, it's wrong. You can reestablish your hydrochloric acid. Now, again, if you have a scar midline, most men have a midline scar. Do you know what that is?
Yes.
You know, because you work here. What midline scar do almost every man in this place have?
Circumcision.
Thank you.
Right.
That's right. Every woman probably in this room has children has a midline scar called a C-section or what? Or hysterectomy, unfortunately, or a episiotomy. Right. So there's a built-in things that are going to make your stomach not work. Those are some of the pain in the butt.
Anytime you've ever had a surgery.
Anytime you have any type of trauma, scar, or toxicity, you have a potential to confuse your body. I call it an allergy. And we're going to get into that in a minute. But the idea here is that first thing to take home is that you probably need this cleaned out if you're going to do any kind of detox. Now, God gives us a way to clean that out. Somebody gave it away earlier. What food cleans out your bile duct?
Turnip.
Who? Tuna.
Turnips.
Turnips.
Turnip.
Turnips?
Turnips.
Beets?
How about beets? Thank you.
That's close, right, Chef?
Beets, clean it out. What oils clean it out?
Oh.
No, but there is
Omega.
no. Who?
Fish oil.
No. Lemon oil. And lemon oil cleans that. Oil of ledum, L-E-D-H-U-M, available through Young Living. Cleans it out. What herb cleans it out? What herbs?
Milk thistle.
No,
It helps your
It's
liver.
supposed to be good
it
for
helps.
the
It's a
liver.
liver cleanser, but I don't think it cleans the bile duct out. But
About dandelion.
dandelion. If that means,
We just
Licorice.
started drinking that tea.
pardon me? What tea?
Karen and I just started drinking
Dandelion tea?
dandelion.
Wonderful.
Where do you
Yeah.
get dandelion from? I've never seen it in
My yard.
Oh, so you just go and you can actually pick.
Or to get dandelion,
They're
my
everywhere.
yard.
As long as you don't spray it with anything.
Give me
So
there.
really, including the
Root,
the
leaves,
little
dry, yeah.
everything.
It's all
They make it in capsules too, you can get it in capsules in health food stores.
Yeah, and you can also get tea as well. You can find it in health food stores too.
What about licorice? It's supposed to also?
Licorice does not.
Liver stuff, I
Licorice,
heard.
yeah, it doesn't really work on the small,
Okay.
we're talking about the bile, these are not, that's more of an adrenaline stimulant. It's like
What was that
an
oil?
appetite,
What was the oil?
appetite stimulant.
Lemon.
Oil of ledum,
Lead 'em.
Ledhum, I believe is the spelling. Susan would know it, she orders it.
I want some of that.
You want some of that? It's stinky oil, boy, I like to give oils people like the smell of. To me, that smells
Like
like,
the lemon.
yeah, to me, that's like, whoa, I won't use stuff I don't like the smell of, but. So, and then if you've had your, don't be afraid to take ox bile. And you certainly can take, there's another thing that I didn't mention that goes in here called the third part of the digestion is the pancreas, and that secretes into the duodenum enzymes. And lipase works on fat, amylase works on carbohydrates, cellulase works on, etc. Protease works on protein, cellulase works on starch, on not starch, but cellulase works on cellular matter, on plant material. So that's digestion there. But if you have a bile duct, I hate to say to this to anybody, you have to do this the rest of your life. That's one thing I hate to do it. But if you don't have a gallbladder, I'm going to tell you, you should do this for the rest of your life. You should take bile salts. Several companies have it. Now you can actually get it in the health food store. When I started in practice, you couldn't. But
You mean ox bile?
ox bile. You need to take that. And if you have any stitches in here, let's talk about poop talk again, okay? So, what should your poop? What's a good poop? What's a poop that you want to be proud of? You just want to try that puppy and put it up there and say, look, kids, children, this is what you need to aspire to. What kind of poop is that?
I heard the S shape.
S-shaped, that's one thing.
Yeah.
How many times a day?
Twice.
Or,
Three.
is 4 times good?
No.
A little too fast. But I have people who go once every 2 days and they're proud, or 2 days, twice a week, and that's not proud. And what consistency should it be? This might be a shocker to some of you.
Like toothpaste.
Thank you. You've worked here before.
Yes.
Yeah. What color should it be?
Light brown.
Dark. I heard everything. Light brown.
Like a golden brown.
Ooh.
Reddish brown.
Ooh, no.
Dark brown.
No.
Dark brown?
Dark brown. If it's dark brown, like dark brown, like Sue's hair, the darkest hair in the room, okay, is okay, yeah.
Like that.
Dark brown.
Like the picture of my.
Kibby's might be a little dark, but
Liz has some dark hair too.
Yeah.
this is a little dark, but a dark brown. And that ensures that you have two things in it, bile and the other thing is bilirubin. So
If you're having a hard time digesting your fats, like if you've been having a lot of salmon and red meat and you're starting to have hot flashes because you can't digest it, what should you do then? Increase your
hot flashes are from your ovary starting and stopping, from estrogen being
So you don't
pulled
think
in
that
the
has
body.
anything to do with
No, it's a
diet?
trigger. The diet will trigger it, okay? Because what's estrogen made from? Fat. Fat, minerals, and enzyme is the recipe for a hormone. So that's two systems working together. But you're really talking about something different. If you're talking about a hot flash, which is different than night sweats, by the way. Hot flashes night sweats don't come during the day. People say, oh, I have night sweats. At 3 o'clock in the afternoon, they're having night sweats. No, it's a different part of the brain, sweetheart. It's actually, night sweats are from the brain and hot flashes are from the ovary. It's the ovary starting and stopping during menopause.
And what's the night sweat?
Night sweats is your hypothalamus, and it has to do with something else.
But if you're eating too many fats, you can get that out of balance. Possibly.
If you're not digesting enough fats, most people have a light stool, or it goes from dark to light, and that's a good indication that you're not getting your groceries. You're not absorbing your fats. And most people say, I can't lose weight, because they don't absorb enough fat. So right away, This guy right here kicks into overdrive. What does he make? Fat. And what does he or her make? The bad fat. So it gets conjugated into the good fat over here, but it can't even get over there. So now it comes out here and all we got is bad fat. And that's where everybody makes a big stink about cholesterol. You know, I have cancer patients going in, come say, what's my cholesterol? I go, don't you want your tumor markers? No, what's my cholesterol? Talk about a brainwashed, numb population. When I started in practice, you'd have to convince a doctor that hypercholesterolemia was an issue, and that was only 16 years ago. 10 years ago, people go, cholesterol, doctor would say, what do you want to do that for? We don't do anything about that. You could have 350, and they go, okay, fine.
They didn't have drugs for it.
Didn't have drugs for it. They weren't worried about it. Now it's like, 201, you gotta have that drug. Are you out of your mind? When you have high cholesterol, if you take a statin drug, which is terrible for you, it wouldn't be, if it was great for you, you wouldn't have to take a blood test twice a year to check on the enzymes to see if your liver's still working or not. Shuts the body off at, I'm going to get on a rant now. It shuts the organelles that make energy off in every cell in your body, especially in the liver. It shuts it, and so you have to take CoQ10. But if you're talking about cholesterol, if it's elevated, two things are happening. So if you have a fire, do you throw your coat over the fire alarm and go, oh, let's just find a solution for this noise? No! You find the hidden toxicity, it's probably not hidden, where you find the inflammation. Those are the two reasons why you have high cholesterol. The last thing you want to do is artificially bring it down. It's like a temperature. Yeah, it gets to a certain point, we're going to put the baby in the tub. Right? When it gets up to 102 or 101, we're watching it closely, but we're just watching it. We're not going to put the baby out in the cold. You know, we're not going to say, okay, let's suffocate the baby so it doesn't have the fever. That's what you're doing, literally, when you take a statin drug. Let's kill the baby so it doesn't have a fever. Are you out of your mind? And I could go on for hours on this, because I have doctors that I teach who don't understand this. It's like, but mainly, if you're a doctor, you need to talk to your patients about it. I know you guys do. And if you're on cholesterol, don't feel, I'm not your judge and jury here, but if you're on cholesterol medication, you really need to take at least 200 milligrams of CoQ10 a day, and then have a plan on to educate your doctor. And first get educated yourself, because people are afraid their doctors won't say anything. But if you're on that medicine, please text me at 404-310-6917, and we'll talk about it. Because really, that's one of my pet peeves. Why I have a sister-in-law who needs a liver transplant because she was on statin drugs. So that hit home.
It's really, really common. I mean, I even heard someone said a quote that they said that they should put statin drugs in the water system. And I went, really?
It's like the fluoride.
Like everybody needed it, or if your cholesterol is 201 or you know.
Yeah.
Yeah. I know.
Yeah. You want to lower your cholesterol? Unblock your bile duct. And so they'll give you a statin drug and they'll unblock your bile duct. What, are you out of your mind? It's a surefire way to kill someone. Honestly, you're ending your life. You're really ending your life with that drug. So, any questions about this before we start to talk about what happens down here? Any question about right here? What happens here is we get not enough stomach acid. How do you fix that? You supplement it.
Hydrochloric acid.
Pardon me? With hydrochloric acid. You got to make sure you're getting enough of it. It really should be done with the doctor. You shouldn't just take it, because if you can only take it, if you're officially low and you only can take a couple of a gram of it or so before you get heartburn, you got a problem. You got a real problem. You have an interference field. You have a scar or something else. Or the other thing is, the #1 parasite in the United States is H. pylori. Very good. H. pylori is Helicobacter pylorus. It looks like a paramecium with a hat that spins on it. That's with helicopter. Pylorus because it lives in the pylorus of the stomach and this duodenum. So that guy is terrible because it has the ability to hide between walls and hide from our immune system and go dormant. But that creates the ulcer. It's also a lot of false negatives with testing with that in stools and whatnot. Even in the breath test, there's a lot. I find a lot of people have been exposed to it, have it, and it's dormant, and it's in teeth as well. A really good dentist will tell you about H. pylori because it's from here to here. It's a spirochete. No, I'm sorry. It's a paramecium. And if you can't take stomach acid, it's maybe the other thing besides the interference field is you have a parasite. And the number one parasite is H. pylori. Any questions about that before we go into leaky gut and the stomach and allergies? So,
You said on the bile salt, ox bile, can you take that continuously? Just
yeah, you should, if you're going to take this without a doctor recommended to you, you vary the dose.
okay.
Go up and down so that you're not really going to get addicted to it forever, and you can wean off it. No matter how long you want, you can get yourself off of it. I think that's a misnomer. So now that we follow our food bolus down, this is the valve of Houston right here, which opens up. By the way, this is all pH controlled, so the valve of Houston is going to be usually stuck on or off in the person, depending on if they have diarrhea or constipated. Usually it's stuck open. Both this and the other valve, which is the ileocecal valve between the small and large intestine right here, these are the two valves, are usually stuck open in most people, unless you have even in constipation they're stuck open a lot of times because the body's trying to force that in. Now, it doesn't make sense, but in diarrhea, a lot of times they'll shut. It's their body's reaction to stop the diarrhea. And it's totally confused because it's all pH driven. All you need to do is get this guy right, and the rest of it will get right. But we had a lot of talk about gluten. Why is gluten a nasty guy? Anybody know?
It hurts your small intestine.
It hurts your, why does it hurt your small intestine? Because it's nasty?
It hangs around too long.
It's sticky.
Yes.
You have all these little fingers in the small intestine, like this, called microvilli. And gluten comes along and goes like this. And so if you're at all constipated or you have a slow stool, moving stools, or your motility is slow, what happens is when it pulls off, this happens. So we're looking at it sideways, and these guys, if we look at it close, there's a good one, there's one. So it's been pulled off. And so what happens is these guys, or they'll miss, there's only one cell layer here. And so you'll miss cell layers. Here's the cell wall, and then from here we have no cell wall. Now this is the thing that determines if the nutrients come in or not. So we eat something, and this cell wall goes, yeah, you're friendly, no, you're not. And gluten rapes it, takes it with it. So this is what creates leaky gut in most people. If you have enough of slow motility and enough gluten, you're going to rip all these cells out. And now the judge that says, yeah, you're food, no, you're not, doesn't know what to do, and it lets especially proteins in. And the proteins go in there, and the protein will wreak havoc in our body. It'll sit in joints, it'll go in protein. Protein is very similar to a hormone, and it sits in hormone receptors and makes changes in our body that we don't like. Like soy, the reason we talked about soy earlier. Soy looks like estrogen to the body. It's estrogenic. Just like hundreds of thousands of chemicals is estrogenic, meaning it looks like it sits in a receptor. And the odd thing about it is it may calm down some hot flashes, it may calm down some female problems, but this is false. It doesn't do it for long term, and it doesn't do it correctly. It's really not good for you. Why? Because as soon as good estrogen comes, it'll kick it out and sit in there hopefully. So it's repairable. But you're walking around with plastic in your hormone receptors. Most of us are. Because we try to do the right thing by drinking non-tap water, which is better. I would rather take the plastic in the water than tap water, frankly, in Atlanta. Atlanta has 2 years ago, Atlanta was #1 in the United States for pollution. 2 reasons.
Wow.
Cars, congestion, and water.
Even with filters on tap water, not a...
No, it changes if you have a filter on the tap water. But most tap, everybody thinks, oh, I got a Brita, that's fine. No, I'm sorry, that's not fine. A Brita is not going to do the work of a commercial filter. You know, a lot of people think, oh, the Brita, I got a Brita, I'm fine. No, a 1995 filter is not going to save your life from the Chattahoochee water. It won't.
Won't work in your shower either.
Well, it's better than nothing. But, you know, I mean, so it's in degrees. It's better than nothing. I've actually, I don't want to do any commercials here, but Culligan water, the first phase only, is pretty good.
How do you brush your teeth? Do you fill
Like
up
this?
a glass of water and put it by your sink and you just
No, I'm not that
rinse
anal. I just use a little, there's fluoride in the water. I just use the regular water.
it? You do?
Yes. You don't have to swallow that water, but of
Yeah.
course you're getting some in it. So, yeah.
I was just curious.
And I'll take a drink out of, if I'm parched, I'm gonna take a water fountain drink at the gym or whatever. I'm not gonna be totally anal about it. I mean, there's just degrees. What you should do is you eat as clean as you can, you live as healthy as you can, and you do your best. As long as you've got the intent and the right attitude, I think God's listening. So you've got that. You know, that's, when you're driving around, you have your little bubble of protection around you. Your aura is all around your car, so nobody bumps into you. There's two kinds of drivers in Atlanta, you know that? Ones are going do-do-do-do-do, and ones are arr. I stay away from the ones that are arr. I'd rather run into a do-do-do-do guy, you know? Someone's gonna run into me. I want the guy do-do-do-do with a smile on their face. You know, I don't want that altercation. So I guess I'm one of those do-do-do-do guys. So how do we get food allergies? Well, this guy leaks, and now the body looks at it and says, oh, well, we think you're sweet potato. It's not a sweet potato. Or we got sweet potato in the bloodstream, or in a place where it doesn't. Now the body goes to sweet potato, we're going to make an antigen against you, or antibody against you, because you're a bad guy, call it an antigen, and now we're allergic to sweet potato. What is an allergy? The only thing an allergy is the body is confused with what it is and what it isn't, or how to handle that. Usually with what it is and where it starts and stops, we call that autoimmunity. So autoimmunity is you're allergic to yourself because your body doesn't understand yourself. An allergy, you can take anything. Your body could be, I had a lady who was allergic to everything except her underwear because it was cotton, and then she eventually got allergic to that. We call those people universal reactors. And that's somebody with leaky gut who never gets treatment. Over and over and over again. But that lady, I know you guys probably, I'll point her out to you next time because she loves me now because she has a normal life. Absolutely normal life. And she's not in this room. But I mean, if I've helped you, that's great too. But the thing is, this is all reversible. But that's what an allergy, as a matter of fact, I have come up with a surefire system. You ready to get this? I've never said this before. To even cure gluten allergy.
Right.
Now, I got to tell you, there's a thing called NATE. Anybody heard of NATE? Dr. Debbie Nabuchapad. I had to go to school to learn how to say that. Nabuchapad's technique for allergy elimination. N-A-E-T. And then there was a CERT, which is Dr. Brimhall's do it with lasers and glasses, colored glasses, and you know, we had to get a Funny Farm certificate when we did that because we were waving around, putting on pink sunglasses and red sunglasses and yellow sunglasses, and then different tuning forks waving around you, and people going, but it worked, except one problem. You have to avoid that for 24 or 5 hours, one acupuncture cycle. Big problem with that. If you have an allergy, how the heck do you avoid that for 25 hours or 24 hours if you're allergic to outside right now? Chris, do you want to do your 2 cents about what happened? Chris came to me with, tell your story.
Well, I've had environmental allergies, seasonal, well, I'm allergic to everything, but seasonal allergies are a real problem for me. And I've had them ever since I've been a small child. And I used to take the yellow sticky medicine. I lived in Missouri, and the bragweed would grow as high as me. And school would start, and I wouldn't want to go to school because my eyes would itch so bad, and I couldn't see, and I had the snotty so bad. I mean, it was gross. And I had to take awful medicine, and it never did help me. And I grew up, and I went to take the allergy shots. I got my first set of allergy shots when I was in my late 20s. And I went through that for 3 years. They stuck you in all the arms and put stuff on your back and told you that you're allergic to everything. I said, great. do this treatment. Well, that worked and helped me out for maybe a year after I stopped taking the shots, and I went back on the Zyrtec. Zyrtec came to the market at that time. I started with 1 Zyrtec a day, and pretty soon I was up to 2, and then I was up to 3, and it wasn't working anymore. And I was miserable, and so they said, well, you're hitting premenopausal, so that means that we need to, you're changing, so we need to redo all those shots again.
Blame it on you, right, exactly.
And I'm like, really? But I'm like, I'm so desperate, I'm willing to do it. So I go back through and start taking all these shots again. I was about 2.5 years into my shot protocol, which is about a 3 to 3.5 year program where you got to go in. And I met Dr. Gallo. And he told me, he says, please stop taking the shots. He didn't tell me to stop taking my Zyrtec at the time because he was in process of working on this protocol. So when it got really, really bad here a couple weeks ago, he said, bring all the stuff from your house and your yard, because I had snotties. I'm in here working and I'm all, it's like, oh, that's a real good business calling card for him. So I brought in my air filter from my house, a piece of that. I brought in hair from my non-allergenic dog.
She was allergic
Was totally allergic to. I brought in samples of my vacuum cleaner bag. I have very little carpet in my house and only a few pieces of upholstered furniture because I'm allergic to dust mites really bad. Was, like the operative word is was. And then, so he treated me with those, he used his technique with those. I was perfectly wonderful when I left here. I went home and I was just fine, didn't have another problem. Then all of a sudden I had a little something come back. Well, what it was everything began to bloom outside. So I had to go get tape samples of outside my house and start bringing things in, and now the grass is starting to come in. So today he had to do grass.
We've only done four
total treatments, and this morning I was all like itchy eyes, but not snotty, just itchy eyes. And by the time I left here with him today, I was just fine. So it is a miracle to me because I really thought living with chronic allergies was going to be my way of life for the rest of my life here on Earth. So it's not, and I'm here to tell you that it's permanent. Because some of the treatment you did, 3 weeks ago now, and I've had no recurring symptoms.
Wow.
My daughter's pretty much in the same boat as me. And
Everything we've done, we checked, there's none of this come back.
Yeah, and he's done, because he keeps all my bags of stuff. So when he tells you if he's going to work on your allergies, do yourself a favor and gather all the stuff that we tell you to gather. Because it will make a difference sooner, quicker, faster, better.
Right. If you come with all the stuff that you're allergic to, I only have to do it once.
Right. But it's phenomenal. It's life-changing for me.
Now, it takes between maybe 10 minutes and a half an hour, depending on if you have an emotional component or not.
Right.
If you have an emotional component like gluten, everybody's got to eat their daily bread. So a lot of people are attached to that emotionally. So can I tell one more story? That's a great story, isn't it? I mean, she you know what the thing that rang in my ears when she said, it ruined my life. And she's got her life back.
Yeah.
That's the thing.
Nothing worse than being a teenage girl and trying to date some guy and you're like got a snotty nose all the time. That just makes you really attractive. And people used to go to me, what's wrong with your nose? What's wrong with your nose? And my nose would always be red. Well, it was allergies.
Yeah, of course.
I was Rudolph.
So, I mean, that's, you get your life back, literally. And 85% of allergies are asymptomatic. In other words, don't have any symptoms. So the things that are bothering your life are typically allergies. If I tell one more story about it, here's another story that wasn't really an allergy like you think about it. Somebody in this room brought her little granddaughter to me, and she had a spider bite. Well, we decided it was a spider bite after I got my vials out and tested it. Now, there's only 2 spiders in Georgia that are poisonous. You know what they are?
Black Widow.
And Black Widow, which if you want to see one, we got both of them at my house. You can come see them. I got a garage full of Black Widows. So and I know what the bites are like from living around in Georgia for 20 years. So I looked at it and went, nope, that's not one of those bites. Because they have a very distinct character to them. And so, but what it was is she was allergic to the venom in this spider. Well, it wasn't a toxic spider, but you could be allergic to anything. But she was so bad, she came in on crutches.
Wow.
Came in on crutches and like, you can't touch my foot. It burns, it hurts, it's so bad. And I went, oh, it's a virus. What do you mean it's a virus? Well, viruses are misunderstood. They really do the body's working. And then, what else was it? It's Jean's daughter. So
Yeah.
what else was it? I don't remember. It was,
I wasn't in the room.
it was an allergy. She was allergic. That's what it was. It was two things. She was allergic to the venom, and she had a virus that attached itself to the venom. That was it, yeah. And so, what did it take? Half an hour, she walks out without the crutches.
Yeah.
Hi, Grandma. And Jean had a beautiful smile on her face. So, what we don't think are allergies are a lot of times are allergies. So, leaky gut. How do you know if you have leaky gut?
Because you have allergies and sensitivities to things you eat.
Look at your poop. Here's poop. I'm going to finish with poop. Poop has to be. If your poop's not like this, there's a good chance your gut's like this. All of us, how many people in this room have leaky gut? Everyone. It's just that everyone is below 1%. When you get over a couple of percent, you're in trouble. Because your body can't handle it. It's actually pretty tight. But everybody's gut leaks a little bit. Bless you. But poop should be large girth, dark brown. We do like to have a big S for the intestine. It should be once, twice, or 3 times a day. And it should be toothpaste consistency. So if you're not like that, if you have every 3 days you have a bunny turd. Pellet, right. If you have a pellet every 3 days, it's probably here, here, and here. So, simply allergies are your body's not understanding yourself. Autoimmunity. MS is we can treat MS now very easily. As a matter of fact, I had a nurse that was shaky, 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 and she doesn't shake anymore. She went back to work, got her life back. So that's really food allergies. Everyone in this, I didn't go over food allergies, but in detail, but everyone in this room really has food allergies as well, and they're treatable as well. Any questions about anything I spoke about tonight? Yes, ma'am.
What about if the consistency changes?
Of your stool.
Yeah, during the same day.
Well, let's take that to the extreme. What happens if you have diarrhea and then constipation? They call that irritable bowel disease. That's really a mini thing of irritable bowel. If you're talking about consistency changing, and irritable bowel is typically you have the wrong pH in your stomach, in your gut, and in your large intestine. So that's number one. Everything I talked about applies. Pardon me?
Yeah, it's all pH.
Yeah, the pH is wrong, and the pH is wrong here. It's going to be wrong here. pH is wrong here. It's going to be wrong here. pH is wrong here. It's going to be wrong up in the esophagus too. This sets the tempo for the entire alimentary tract. So I'd say that's like a mini irritable bowel when it changes like
Better
that.
than a maximum.
And so if it goes from color changes from light to dark, of course that's fat. It's lighter color when the fat goes through you. You're not getting your groceries. It's darker color when you're actually processing your fat. That means that the bilirubin and bile are created and being used when it's dark brown. That's why we want it dark brown. Now, if it's really black, I should say, that means that you probably have intestinal bleeding, and more than likely you might have H. pylori or another parasite. And if it's red, it could be that you have hemorrhoid, or that you could have irritation that's bleeding.
Or you ate too many, or you ate 8 beets that day.
Or red beets.
Oh, beets will do that too.
Beets will make, don't freak, if you eat beets,
Beets will
don't.
scare you if you have
Yeah.
Whoa!
You'll even pee red, so don't freak out.
Yeah, so what's the deal about peas? We talk pea talk too, or what?
For a minute, yeah. We got about 5 minutes.
I guess it depends.
Pea talk. So what is really, what if it smells like asparagus? What is that about? Everybody asks me that all the time.
Yeah.
That's my most asked pea question. What's asparagus pea smell like? What is that from, Dr. Gallo? Anybody know the answer to that? Come on, docs. You don't know? No? It's sulfur. It's sulfur. That's what's in asparagus that makes that smell. Any other questions?
What color should it be?
Good question. Very light yellow. If it's dark yellow, you're dehydrated. If it smells like fruit, it's probably sugar in it. It's fruity smelling. If it's really dark, like an orange, you might have blood in it, and that's maybe infected. If it's cloudy, it's also probably infected. Or it could be prostate problem if you're a man with sperm in it. Any other questions?
Wouldn't a lot of supplements maybe make it? Darker yellow?
Yes, bright yellow is typically B vitamins. Good questions.
When my bile duct was clogged up and I had stones that had lodged in it turned dark brown and my poo-poo turned white.
Yeah, that's the tip, or clay color stool, yeah, that's
I
the
had to
typical,
have surgery.
yeah.
I had pancreatitis.
yeah.
But I just wanted to mention that. You need to go to the hospital.
Yeah, you do need to go to the hospital. Yeah. So this, that's a good point. Thanks for bringing that up. And actually, so again, why is that? Because if this is not happy, this is not happy. So this is a potential problem here. You're gonna lower, if you need this, you more than likely need enzymes. If you need this, one of the things you can just blindly do if you want to help yourself, you can go to the combination tablet that has hydrochloric acid. I recommend at least starting out with 1/2 gram. And you should also have some enzymes in there and some oxbile.
How long do you stay on the HCl?
How long do you stay on the HCl? Depends on what we're trying to do. Actually, one of the old-timey things they did in the 30s for Lyme disease, when they didn't call it Lyme, they call it spirochetes, and parasites, parasite cleanse in general, is to take between 45 and 50 grams of hydrochloric acid a day. It kills parasites. And so it depends on what we're trying to do. Now, you have to have a good stomach to take that, because you can't have any interference. You know, you have, but it's, what should the stomach pH be, by the way? And how do they measure that? These are all great questions. Thank you, Michael, for asking. It should be 1.5 to 2.5, which is going to burn a hole in wood.
Pretty acid.
That's pretty acid. Most people are walking around 3.5, 4.5, 5.5, you're sick as a dog. Now, how do they measure that? Mostly the problem is they don't. But in the old times, they used to put litmus paper down on a string, they bring it up and try to measure it. Well, that's stupid. I mean, it dilutes by the time you get it up, number one. Now they do it, they swallow a radio capsule transmitter. Now, I don't want to poop out a radio transmitter, but since what we're going to do anyway is substitute hydrochloric acid, what, we want to just do that anyway? Yeah, if we know how to use reflex testing, we can. And so the question was? What was the question?
How do you test for it?
How do you test for hydrochloric acid?
No, for the pH.
How do you test for the pH for in the urine?
Your stomach.
In the stomach.
Oh, in your stomach? Well, that's right. I'm sorry. I think that's how do you test. I answered that then, didn't I? No?
And
How do you
it's
test
just,
your...
I will tell you though, guys, it's really important to be under a qualified physician that understands hydrochloric acid and can help you work through it. I know we work with titrating it, and people sometimes don't even understand. You don't even have to have heartburn. You can actually end up having diarrhea before you have heartburn. So there's a few little symptoms that happen along the way that can also let you know that your acid's finally gone to the right level. And then you take the pills back down per meal. And like some people have to stay, I mean, I know, for example, when I'm going to eat meat, which is very rare, but when I do, I make sure I take some hydrochloric acid, because otherwise I don't, I'm pretty sick.
Yeah, we need to work on it more, because you weren't there.
And I'm just not there yet. But I mean, everybody's, and I know my daughter is a prime example of extreme leaky gut, and you know, it took quite a few pills for her, and it began to freak her out. So don't freak out if we tell you just keep taking the pills until you experience those symptoms, because I think she was up to like 36 pills at one point, and then we've been bringing her back down. Mm-hmm.
Not a day.
Not at one meal.
Every meal.
And she was like, "Mom, I can't do this anymore. Like, I can't eat this many pills."
Some people are laughing and experienced that in this audience, I think.
And I think there's another guy in here that's experienced that as well.
So I'm concerned that I didn't get your question. The question was, how do you measure stomach acid? You either swallow litmus paper and bring it up, or you swallow a radio capsule, or if you're in my practice, if you'll stand up please, you find out somebody who's testable. And they've got to be testable. You know, I go through grounding first, and then I go through whether or not your computers are all, your biological computers, in other words, your brain and all the things in the body that act like a brain are working. So in other words, your body understands itself. And then we also make sure that you're muscle testable, which means I go through Is your polarity right? Is your sympathetic nervous system able to be balanced? Does your right and left brain speak to each other? Are they synchronized? Does the quadrants of the brain work together? And then lastly, is electricity bothering you? So, and also, are you heart-brain dyslexic? That's just to be muscle testing you. If I can't do that, I've got to use your chi pulses, and that takes an awful long time. So we try to fix that first, and in fixing that, we do fix a lot of things. So as long as you're muscle testable, you can come over here and swipe up on the liver, and then muscle test. And he's, right now, he's okay. Now, is that optimum? Well, yes, that's optimum. It's not optimum. No, it's not at optimum right now. But he doesn't have to have it to, it's not like one of the major things going on in his health. But we can ask, is this optimum? No, it's not. So that'll last for about 2 minutes, and then we'll go back to strength again. Thank you, sir. Any other questions? Thank you. Yes, ma'am?
Could a extreme chemical imbalance in the stomach possibly cause encephalitis?
Encephalitis is inflammation.
Inflammation of the esophagus.
Of course.
Inflammation and ulcers.
Esophagealitis or encephalitis?
Esophagus.
Oh, okay. I thought you were saying encephalitis.
No.
I did too.
Esophagealitis. Absolutely. Absolutely. Anytime that top sphincter, the cardiac sphincter in the stomach can't shut. Why can't it shut and tight? It doesn't have the right pH. If it's too alkaline, that won't stop. I forgot one thing I wanted to tell you guys tonight. The number 2 thing besides blood sugar is anemia. Anemia means that you don't have enough oxygen anywhere. And there is the anemia of chronic disease, and the 2 most popular anemias are the anemia of B12 and iron. Everybody thinks of iron. But if your stomach doesn't work, it doesn't make stomach acid. If you don't make stomach acid, you don't have intrinsic factor. If you don't have intrinsic factor, you cannot utilize or produce B12. So here's another reason to keep this tip top and take stomach acid. You're going to be anemic. Everybody get that? That's a huge reason. If you're walking around with your knuckles dragging, stomach acid. That's one of the biggest anemias I find in my patient. It's really easy to check for. It takes 5 seconds to check for it once you're tested. Any other questions?
Let's thank Dr. Gallo for that information. Hopefully you guys experienced something that could change you or change your life or help people that you love. If you've gotten some good information this evening, I also want to let you know that the big special event is coming up May 11th. If you have not received this email, if you make sure that you put your name and your email on this list, I will make sure you get it. But May 11th, Dr. Gallo and Dr. Gary Gordon, who is the father of chelation, known as, and he's a wonderful, wonderful speaker, will be having a joint seminar to be held at the Perimeter Dunwoody Holiday Inn. It's a $20 charge, but you're getting lunch. You're getting gift certificates to both this practice and our joint sponsor, which is Quantum Light Effects. And you'll get a wonderful day of seminars and knowledge. And Dr. Gallo will be speaking more in depth on allergy at that seminar. So if you know friends, family, people that also need to be exposed to the information that he's giving, and he will actually choose a couple people from the audience that day to actually do his technique on. So if you're feeling lucky and want to come buy your lottery ticket and get treated by Dr. Gallo, go for it, right? But it's very simple to sign up for. You actually can just go right to the email or to our website, to the special events page, click on the link and buy your ticket right there and print it out. So we hope that you guys enjoyed this evening. Our next session will be May 7th. I'll send an email out on that. But we will be talking about, we're waiting to confirm our special guest, but it looks like he's going to be able to join us. And that should be another exciting, we're hoping so, yes, we're hoping so.
Oh, cool.
So he's very entertaining. He's going to talk about parasites. And he's just a really entertaining, fun guy, and then Dr. Gallo will get to talk about parasites too, and how he rids the body of those. And let me tell you what, that's something else that changes people's lives every day. So we thank you guys for coming. If you need to sign up to the list, please come up. If you need any information on Kibby, let's thank Kibby and Scott for coming all the way down here. Thank
Thanks, guys. Have a great night.
Thank you.